Hello, everyone, and welcome to our Masterclass. This is Dr. Joyce Martin, nurse practitioner, formerly chiropractor.
Hello, and I'm Anthony Spardello, registered nurse, registered holistic nurse, board certified, and we're here with RegenRX. Welcome. It's nice to have you all here with us, and welcome to everyone that was with us in our last Masterclass and everyone that's new to us today.
All right. So we're going to dive right in. I'm sure others will be joining us as we go along.
Yes, but we'll get into the presentation, and hopefully everyone is with us now or will be with us soon. We look forward to you learning a lot about advanced facial rejuvenation.
This is Dr. Joyce Martin from RegenRX. Welcome. We're going to be waiting for a few more people to join on. I'm here with Anthony Spardello, holistic nurse, registered nurse. We work together. Anthony is actually in nurse practitioner school. We're so excited about that.
Yep, to spring 2018, I'll be done with that, God willing.
Awesome. That's awesome. All right. So let's start with advanced facial rejuvenation protocols. This is going to be a practical, protocol-based training for advanced aesthetic practices and practitioners. So good evening again and welcome.
Yes,
Today
welcome.
we're going to be talking about facial rejuvenation in a way that goes beyond single treatments, single syringes, or one-off visits. The goal is to think like a practitioner and practice owner at the same time. What is driving the patient's concern? What sequence is safest? And how do we create a treatment journey that produces natural outcomes and long-term value for our valued patients? This presentation is educational. Every provider should adapt these concepts to their scope of practice, training, product labeling, state regulations, and medical oversight. Let's look at the roadmap for the next hour. This is going to be the flow of our training. We're going to move through several parts. First, we'll briefly discuss why facial rejuvenation needs protocol-based mindset. Then we're going to review what drives facial aging, such as skin quality, collagen loss, fat compartments, supporting structures, and fluid changes. After that, we will walk through advanced assessment, treatment sequencing, case examples, and finally, how protocol-based care improves the patient's experience and the business model. Structure is important because the best results usually just don't come from doing the newest treatments first. They come from matching the treatment to the tissue and putting steps in the right order. The first mindset shift is moving away from selling individual services. Anthony?
Yes. So when we go into selling individual services, we have seen that individual services may make your patients happy for the short term, but what your patients are really looking for is more a whole protocol, not just one-off treatments, as they call them.
Mm-hmm.
So premium aesthetic practice doesn't sell just units, just treatments. It sells a planned clinical journey tailored to the patient themselves. So single service visits make clinics easy to compare on price, which can be a problem for some clinics. Those protocol-based care connects assessment, sequencing, and retention of those patients. You're making happier patients that are going to last longer and keep returning to your practice. And the healthcare practitioners that can lead with anatomy, education, and outcomes usually see the most success in this kind of practice and building these protocols, not just these treatments. So with that said, one of the biggest traps that we see sometimes in aesthetics is the race to the bottom. When a clinic competes only, let's say, on a Botox price per unit, or a filler per syringe, anything like that, monthly discounts, we even see, it becomes easy for patients to compare your services at your clinic to services at another clinic right down the road. So protocol-based care changes that mindset, not only for the practitioner in the business, but for the patients as well. Instead of asking how many units do you want to the patient, or what treatments do you want today, try to shift gears of thinking for a moment. So you can say, we ask at Regen, what's driving the change you're seeing, and what sequence will give the safest, most natural look that you're looking for as the patient. So it's a clinical shift, but it's a business shift as well. Clinically, it helps us avoid treating one visible complaint and then missing a whole nother picture with the patient. And then when we can see this protocol-based treatment done and see the whole change to the whole patient, that's when you're going to be most satisfied as a provider or a business owner, and the patient's going to be most satisfied as well and keep returning for service. To build the right plan, you first have to understand what's driving the facial aging process, because it's not just one thing. You have to understand what's driving that to best treat your patients. So let's get right into that. What is driving facial aging? So facial aging is a multi-layered concept. We have the dermis, collagen, elastin fragmentation, hydrogen changes that take place in those dermal layers. We have our fat compartment. Selective loss happens with those compartments. Descent compartment changes. We all see that, especially if you've been doing aesthetics for a while, any fillers. We see those fat compartment changes, those volume losses. Ligaments and soft tissue, loss of support and laxity to those. Bone and muscle structural support. We get those mimetic lines, expression patterns, and then the environment, of course. So even the foods we eat, chronic causes of inflammation within the body, which can be caused from food. Environmental exposure, UV exposure, smoking, any kind of weight change, or any kind of crazy stress change to the body. All these things can change how your face is aging and what's going on with each structure here. So being that layered process, that's why patients will ask, what else can I do? What else can I do? So patients, sometimes they'll come in, for example, and they'll say, I want to have under eye filler or cheek filler or Botox, something along those lines. But no two patients are going to need the same exact plan. And that's a trap sometimes they can fall into. Treating every patient as the same, but we can't do that. We have to know that each patient's face is different. Each patient ages a little differently depending on their lifestyle. So we really have to develop these own protocols, patient specifically, not just for a group. The treatment plan should identify the dominant driver of what is causing facial aging first. So is it a skin issue, quality, support, a movement problem, volume, is there fluid retention, or is it a combination of all these factors? And it's a combination of all these factors. What's the best treatment that is going to treat the underlying factor to then build upon these layers, like scaffolding under the skin to help get what the patient is ultimately looking for. So one of the most misunderstood things, again, in aging is that facial volume loss. Not a lot of patients understand how facial volume loss actually happens. And I'll have Martin explain that.
So this is a slide that I show actually patients, and I show them how the malar fat pad in this exact clip here in this photo is a middle aging patient where that actually is moving down. That fat pad, that malar fat pad is actually moving down. So this is the volume loss, the deflation, and the descent pattern. And so the difference between deflation and supported restoration, here we're showing the difference. On the left, you can see the volume loss pattern. the cheek support loss, under eye shadowing, flattening through the midface, soft tissue descent. When support is lost, tissue can look heavier even when the patient describes it as hollowing. So it's not a true hollowing, it actually is a heavier tissue in that specific area. So on the right, the image shows the concept of conservative filler support. Notice that the goal is not to overinflate the face. The goal is to restore enough structural support so the cheek, under eye, and lower face look more balanced. I can't tell you time and time again, people come in and they're like, oh, my eye bag. But actually, it really isn't a true eye bag per se. It's that malar fat pad that has descended.
Yep.
This is where the practitioner's judgment matters. Volume loss doesn't automatically mean more filler. It means we assess where support has been lost, whether the patient's a good candidate, and whether skin quality or fluid needs to be addressed first. Because if you're putting filler on top of fluid, that's not going to have a good outcome. Helpful patient explanation is we're not trying to make you look different. We're trying to restore the support that helps your face look rested and balanced. So we want to stay away from implying we're lifting something. Really, we just want to emphasize to the patient, we want to, in a conservative manner, support and see if they're really a candidate for filler or see what they're a candidate for. So now let's separate true volume loss from malar bags, malar fat pad bags, and fluid-related changes. Malar bags are one of the most important areas where assessment protects the patient and the provider. A patient may come in asking for under eye filler, but what we see is not always volume loss in that area. Like I said, it could be the cheek that's causing that problem, or it could be fluid. Also, malar mounds can be influenced by retaining ligaments, tissue laxity, lymphatic damage and drainage, inflammation, allergies, sleep, salt intake, and prior procedures. So if we add filler into that fluid dominant area without recognizing the pattern, the patient may look puffier or more swollen. And that's not what they want. And it's not what we want for the patient. The practical assessment is to look for the mound over the malar eminence, morning swelling, fluctuations, a history of prolonged edema, a prior filler that seemed to hold some water. These patients may need a different sequence, such as improving their skin quality, reducing the inflammation first, and avoiding filler in that zone at this difficult time. The teaching point here is not every shadow is a hollow, and not every hollow should be filled. You know, think about this, all of you providers and clinicians. How often do patients ask for under eye filler when the issue is more complex? Mm-hmm. With those drivers in mind, let's move on to that consultation process.
So the consultation process, number one, the consultation is going to be one of your most important times between you and your patients. It's the time where your patients are going to start feeling more connected to you, build any trust in you. And it's also a time where you're going to be able to analyze and see what's really going on with the patient themselves. So when you make your own consultation flow, you want it to be simple to a point, not overly detailed, overly exaggerated, because as you take them on as a patient, you're going to learn a lot more than what just your initial consultation is going to dive into. Once they trust you, once they start building a rapport with your practice, they're going to tell you a lot more about their personal lives, any kind of family things going on. So you really will build a strong rapport with these patients and really see what's going on with them. So for the advanced patient assessment, a strong protocol starts with a strong assessment. And as providers, our assessment skills should be strong, and it's really at the core of anything that we do as medical providers. So It should feel structured, not random. You should start with the patient's goal first. So what are you hoping looks different, or what are you looking to improve? Then clarify what they do not want. That's a strong as well. You want to clarify what they do not want, or what your own professional recommendations of doing this over the years would you think would work well on them too. Because let's remember, they're there because a lot of the times they don't know what they want. They want to see the provider. They want the provider to give them ideas or any kind of little hints as to what could facially rebalance them better and improve their own healthcare outlook and everything like that. So you want to make sure that you're clarifying what they don't want. Many patients want to look rested and restored, not altered. And I can't stress that enough, especially I've seen over the last few years, that fake look, that fake overfilled look is going away. Most patients want to look natural, subtly kind of changed and refreshed. So they don't want those heavy kind of fillers. With any kind of consultation, you're going to review your history with the patient, medical conditions, any medications, allergies, autoimmune issues, any tendencies of swelling, especially with any kind of injections, weight changes, any prior aesthetic work, so you know if anything has been done previously, and healing history. How well and how fast does this patient usually heal after any kind of procedure, minor cut, even anything like that? This matters because when you're finding that right candidate for facial rebalancing, as we like to call it, a regen, that's going to be huge out of your outcomes. You want to make sure you have the right candidate to get the best outcome for both you, the practice, and the patient themselves. Then examine their face. So you're going to examine the face in layers, the skin, the volume, the movement, the laxity of it, any edema that may be there, the symmetry of the face, because let's face it, I haven't met many people that are symmetrical on both sides of the face. So we want to look at all those different things and get a clear picture of what's going on. And then present the plan in stages. You don't want to overwhelm your patient. They should leave knowing what comes first in that plan of action, that protocol. What comes first? That's the most important when they leave that office. And then what comes later after that. And why you're doing these procedures as well. Don't just say this is going to do this. Educate your patients. They will thank you immensely when you educate them, even to the smallest amount. Not a lot of these patients are coming in knowing exactly what they're going to get done or anything in the clinic. So make sure you educate. And emphasize that this is a commitment not only to the patient, but to you as well, as a business owner, as a practitioner. You're putting your time, your money, and your resources on the line to help those. So you want to make sure that you're doing the best you can for your patients. So that consult, when it's structured, builds a lot of that trust and honesty and confidence in the practice and you as a provider as well. So next we'll give some examples or a simple map for making kind of these decisions. So when we're mapping the face, we're going to do this before we do any kind of treatment. And we map the face by category. So first we do skin quality, then which is the texture, pigment, pores, hydration, any photo damage to the skin. Then we do the structure. So the fat compartments, that adipose, the bone support they have, the ligaments, and any descent that we may see visible. And then we move on to the movement, any dynamic lines, muscle balance, facial expression pattern with any, smile, anything like that. Then to fluid, so any malar edema, festoons, lymphatic congestion, and allergies. Lymphatic congestion, that's a big thing I see with a lot of patients too. We don't drink enough water, most of us. So that's a huge thing that can have an effect on the skin quality, the texture, and everything like that is fluid. So we want to make sure that our patients are hydrating enough, things like that. Then we're looking at the risk vessels where we may be putting any of these injections, biostimulators. We want to avoid any kind of injections directly into vessels. Any prior filler, medication, any autoimmune, inflammatory history, diseases that they could have any kind of reaction or side effect from anything that you may be doing for them. That's very important. We have to know. And then the readiness. So the expectations of the patient, the expectations that the patient has of you as a provider as well. You want to make those clear. And then the maintenance. What's it going to be to maintain this look or this service treatment after I have it? A lot of patients will be like, oh, is this a one and done? How long does this last? So it's important to set those time frames, set those expectations, honestly. And then photos. We are always doing after photos. I cannot stress enough. Joyce will say the same thing on the importance of
Definitely.
Of course, all patients are signing consents and things like that, which you'll have in place. But we'll have so many patients come in and say, well, I had the sculpture, for one instance, as a filler 6-8 weeks ago, and I don't really notice a difference. And as providers and as the nurse, I have seen this patient before. We can notice the difference, but of course, as a patient, we are our own worst critics. So when when the patient does come in saying, I don't really see a change, but then you have that data to show them, it makes a huge difference because they can say, oh, I do notice this change, or I was focused on this area too much. So it's very important to have that being part of that readiness. And then, of course, the budget, recovery time, things like that, recovery time after any kind of procedures and things like that. So once this whole mapping of the face is complete, the treatment order becomes the next major decision that you as a provider or owner have to make with your patients. And I'll let Dr. Martin describe that.
All right. So sequencing is very, very, very important. It's a strategy. In advanced rejuvenation, the order matters because one step can improve or complicate the next step. For example, treating inflammation or skin quality first may make later injectable work cleaner and more predictable. A common sequence is we prepare the skin and the inflammation. Then secondly, build collagen support, followed by restore the structure and the contour, balance movement. I can't stress how many times I actually tell the patient, we're going to balance you. Polish texture and pigment needs to be addressed next, and then maintaining the results. And that will bring you patient loyalty. Not every patient needs every step, but every patient benefits from a plan. So the product is actually the plan. It's not just the tox, it's just not the filler, it's just not the peel. They're going to benefit from the plan, and they appreciate that.
Yes, yeah.
Absolutely. The approach prevents overcorrection. Like Anthony said, he's the guy. He knows what guys want and like, and it's not any overcorrection or anybody looking fake. People don't want that. Women don't want it. Men don't want to look at it. So we're in the right place at the right time for regenerative aesthetics. When we chase every line or hollowing immediately, we can make the face look very heavy, puffy, unnatural. When we stage care, we can reassess after each step and refine more safely and get just a better outcome. And it makes the patient happier and it makes us happier. For the practice owner, sequencing also improves retention. The patient's not coming in for random treatments. They are moving through a planned journey with milestones and follow-up. We want things to be staged, not rushed. So now let's get on to our next slide to match modality to the tissue issue. Anatomy and patient goals. So important. The modality matrix helps us avoid using the same favorite treatments for every complaint. No two people are the same. Skin quality may respond to skincare, peels, microneedling, radiofrequency, or even lasers. Collagen support may require biostimulatory strategies and/or energy-based remodeling. Volume and contour may require filler or biostimulatory volume support when anatomy is appropriate. And I want to stress this, when the anatomy is appropriate. Dynamic lines involve movement, so neuromodulators may be appropriate and often are when indicated. Malar fluid requires caution because adding volume may worsen the problem. We might want some lymphatic drainage prior to that. Maintenance often includes photos, home care, seasonal refreshes, and retention planning. The best plan is usually layered, not maximal. Layered means each tool that we're utilizing has a reason, and we share that with the patient, and they appreciate it. Maximal means we are doing too much too soon. The tool should follow the tissue diagnosis. Before any advanced protocol is delivered, safety has to be built into this system. I can't stress that enough.
Yes, yes. Safety, number one, before we're doing anything as a practitioner, as a med spa owner, anything. Safety, safety, safety.
I learned that way back in nursing school.
That's right. In day one nursing school, you learn safety and do no harm. And that is the motto.
Exactly. And I tell patients often, we need to do the best thing for you as if you were my daughter, my sister, my cousin,
Exactly.
and that we care about them and we tell them we care about them.
Mm-hmm.
So let's move right over to safety, candidacy, guardrails.
Yes.
Okay.
So the advanced protocols, as Joyce said, only work when safety is built into the system. With that, before any kind of treatment, we're reviewing some medical history, the medications, allergies, a previous filler, any device records, standardized photos, and then contraindications and consents. Within that medical history, of course, you want a surgical history, anything like that, to hospitalizations. You really want to deep dive into see what's going on with your patient in a history sense, in a medical history sense, just so you're making sure that any treatment that you're going to do is going to be the safest form and that there's no contraindications. So during treatment, safety depends on anatomical knowledge, appropriate planes, so knowing your planes, sterile workflow, your careful technique, that slow injection when applicable, aspirating at a certain rate when applicable as well, settings on devices, whatever kind of device you may be using, and then endpoint monitoring too. So monitoring on your end, your staff, what to know to look out for if there is an issue with any kind of device, and preventive maintenance as well with that. You do want that sterile kind of workflow, keeping everything sterile and neat. And then, of course, emergency kit access, which is required in every practice that I'm aware of in the country. So you need to have that emergency kit access. And then after treatment, we want to provide clear instructions to the patient. We give written, I like also verbal and written, and teach. I love the teach back method with patients. Okay, did you understand what I said? Do you have any kind of questions? How do you actually, care for this? Can you demonstrate massage techniques after this filler, things like that? I like to do with the patients just to make sure that they fully understand the protocol and the aftercare and things like that. Red flag education, so let these patients know what to look out for if there's any kind of warning signs of that there could be any kind of reaction or anything like that. And then follow-up photos. So you're going to do your follow-up photos, complication pathway. So you want to let them know the healing timeline, the follow-up plans, any education with those complications as well that they could have during that healing time. And then, of course, your documentation and team huddle. Documentation, again, from nursing school, if it wasn't documented, it didn't happen. And that can come and bite you in the butt. So make sure you document everything. And from a business point, premium care requires some premium systems that are required as well. So a clinic cannot position itself as advanced if, so let's say, the follow-up, the consent, the documentation, and everything else is kind of disorganized. So how's that advanced when everything else is all over the place? So again, you having this protocol in place and having it all structured and fluid is going to be the best for you and your patients. So when we take this, we can apply this now into thinking to real world kind of case problems with everything that we've gone over so far.
Also, I want to add with the safety, we're very social, Anthony and I, and we talk to our patients. What are you doing for the 4th? And you want to definitely know, do they have a planned trip? Are they flying somewhere in the next 3 or 4 days? Because there are certain procedures that you need at least a 1-week window, preferably 2. So I think that's a very important thing to figure that out.
Yes, no, thank you. Very important. Because a lot of patients will come and say, oh, they're having a filler or something done. By the way, in 2 days I'm flying. It's like, well, okay, hold on a second. Put the brakes on. We'll discuss this when you get back.
Right. Right.
So case study 1 here. Most patients, the majority of a lot of patients, especially as we age, is I look tired. And again, it's not always that it bags under the eyes. It's a lot of the times that volume loss. So the patient will come in saying, can you just fill under my eyes? I just look tired. Fill under my eyes. I'll look so much better. And nobody will be complaining that I look tired all the time. So again, this is a classic case, but the request is simple with fill under the eye, but the anatomy of that patient might not be that simple. So on assessment, we may see the tear trough shadowing that mid-face support loss. And then thin skin, malafluid tendency. So if we're only chasing this under eye with filler, we can then create some puffiness or an unnatural transition from this area to the rest of the face. A better protocol and logic to this would be to determine what should be treated first. Does the patient need skin quality improvement? More hydration? Does the mid-face of the patient need more conservative support? Or is there just a fluid issue that's making a filler more risky? It's got a lot of fluid retention in there, and now this filler and introduction of a filler will make this more risky of a procedure. So does the patient need that education? That under eye area cannot be treated like a simple wrinkle would with any kind of tox. So the teaching point is that under eye complaints often come from multiple drivers rather than just under eye volume loss. We see it all the time. All the time. It's not just under the eyes. You'll lose volume under the eyes, and then we start losing volume here. It starts to pull everything down. If we just fill here, this will look nice, but everything else is still going down. We have to fix in a conservative, in a very methodical way when we're doing that. So you're going to do photo reviews 2 to 4 weeks. We always have our patients come back within 1 to 2 weeks just to come into the center. We want to put eyes on the patient, see how they're doing. We want to hear from them, see if they have any concerns, anything like that. And again, this is a great time to see how well they're healing. How is their healing time? Should they come in for a procedure within the near future? So this slide's really main focus is not just the best first step. Pump the brakes a little bit, and let's go back when a patient's just saying, can you just fill under my eyes? Now, of course, it can vary between patient to patient. You can have a 22-year-old come into your clinic. Can I have a little fill under the eye? Very rare is that the case, but The rest of their facial structure they may have more adipose and fat pads under there, myofascial fat pads. But again, you don't just want to go straight to fill in that patient as well, and you want to explain that, what the risks or concerns could be getting that procedure done at that time in the long term as well. So the next case that we'll discuss, we see it's common after major weight loss, which is a huge thing these days, especially with GLP-1s. So we're seeing a lot of people coming in with that because they're losing the weight, they're losing the volume in the face as well with that weight loss. So they're needing that facial rebalancing after the GLP-1 use.
Not to mention, depending on the GLP-1 that they're on, or 2 or 3, they might be muscle wasting as well.
Yes.
And that is going to affect the face. So I just wanted to make a note. It brought back a memory when I was in chiropractic college. And I was taught by my professor, he who treats the site of the pain is lost. Meaning, if we have someone with lumbar radiculopathy and it's going down to the toes, we're not treating the leg and the toes. We're going to treat the root cause of the issue. So I just a little thought that came to mind. So what we want to find is that main driver and identify the root cause of where it's all happening from. Okay, so weight loss. Post-weight loss patients are often saying to us, my face looks older, it looks looser, what's happening? And the fat loss removes actual support. It loses the skin recoil, as well as collagen remodeling is lagging behind. Common findings include the mid-face deflation, lower face laxity, skin crepiness, and heavier folds. The mistake is trying to refill everything immediately. That can make the patient look bulky or kind of just unnatural. And I see that in a lot of patients when I have to say, and I'm sure many of the providers here can say, when people come in, the woman's, 40, 50, or 60, I don't like this. This is what bothers me. Well, we can't just treat this. We have to assess what's going on above and everything else that we mentioned. So the mistake is trying to refill everything immediately. A more thoughtful sequence may include preparing the skin, rebuilding the collagen that was lost, measured volume support only when appropriate, and maintenance. These patients often need education that improvement is staged. It's not right away, especially when the skin quality and laxity are part of the concern. It didn't happen overnight, and it really shouldn't be fixed or tried to fix overnight. The third case is a patient who wants prevention and natural results. And we're seeing more and more of this often. So the patients will come in and say, I don't want to look overfilled. I don't want to look fake. I don't want my face to walk in the room before me. I want to look refreshed, but not different. These are great long-term patients because they see the value and they want the education and they will go for the maintenance. The plan may start with a baseline of photos always. And I will tell you, I have a 2-part check system. I'm using 2 cameras. God forbid one dies. It happened today.
Yep.
Have 2 cameras, please. And you can either do skin scoring, or our latest and greatest is the AI digital skin analysis. And then, of course, daily skincare and photo protection. I can't tell you how many patients just refuse to wear sunscreen. It's and it's an important piece. The skin is our largest organ. We want to protect it. If indicated, conservative neuromodulation can help with the dynamic lines, of course. So they'll need a tox. We have microneedling, radiofrequency, peels, laser-based options, which can support the collagen, texture, and pigment over time, not immediately. The important point is restraint. Prevention patients do not need aggressive correction. They don't want it. They need a consistent plan that preserves natural expression and helps them age well and gracefully. So we want people to be refreshed because that's what they want. They don't want different. They want maintenance and they don't want an immediate makeover. So now let's connect these clinical protocols to the business model.
Yes. So for the business model, so high ticket positioning is very important. It's not a price trick. It's a value system built on assessment, outcomes, and follow-throughs. So if I'm from this whole slide that I'm going to go through here, the most important takeaway here is going to be that when you're setting this up, you want to make sure that you're not just selling again units or a transaction or a service, that you're selling a plan that your patients and your providers value and trust. Protocol-based care moves from the clinic to the relationship with that patient. So right when that transaction happens, when that patient comes in, has the service, pays for it, building again that relationship is well there. And that's when this comes into play. So instead of one treatment at checkout, the patient receives stage plan, tailored again specifically to that patient, photos, education, follow-up, and maintenance. So this will increase revenue per patient without simply increasing your patient volume. It creates a clear expectation both for the practice and for the patients, and better patient experiences. And again, when the patient has a better experiences, the practice is going to have a better experience. You're going to get more patients through referrals and things like that. I mean, patients come into us, Joyce, and they just love to see us. We're like a part of their family, some of these patients. And
Yep.
it's what you want to build. You want to build that family. Because patients understand at that time why your plan may look different and cost more than your competitors, because your plan is tailored to that patient. They see it more complete because they've built that relationship with you. It's safer for that. It's clear. It's a safer sequencing of that plan and of those protocols. And the patient expects better outcomes because of the relationship they've built with you already and because of the trust in those protocols. So with that, a protocol is only as strong as the patient experience around it. So patient experience and protocol have to go hand in hand. When we come to the patient experience, a premium protocol needs a premium patient experience, a patient journey. The steps sound simple, and they pretty much are. It's you want to educate, diagnose, prescribe the plan, follow up, and then retain. How you do that sounds simple. Those steps sound simple, but how you do that can become the challenge. So education helps the patient understand the aging drivers, what is driving their change specifically, and what can be done to help or correct that change. Visual diagnosis through photos, facial mapping helps the patient objectively see what is actually going on as well. Prescribing the plan in that staged protocol, not just off of a menu and items and things like that, turns that consult now into a clear pathway for the patient with their desired results. The follow-up, we review the responses, the fine sequence, that's showing that the outcomes matter. You're seeing these patients after you do something. You're not just saying, "Here's the service. Thank you for paying for that, and see you later." No, we are following up with them. You're following up. You're further strengthening that patient relationship, and then retention then just keeps the patient in that maintenance of keeping the look that they want or the service that they've had. They spend all that money on it. What's the best way to maintain it so they don't have to spend that money again? So that's helping with that again, keeping the patient in the doors, keeping them coming back for more, and keeping everything defined with that patient so they have those clear expectations. But this all in all helps the team. Everyone knows the language. We're all on the same book. The sequence is the same, again, tailored for every patient. But in a sense, as the business grows, it becomes like second nature when you start to do this. And it makes the clinic feel more organized and professional. It can be hard to adapt at first to try to change these things, but they will benefit to you and your practice and your patients. So with all this, let's close with the main lessons with Joyce and I that we've been learning and going through within the past hour.
All right. So in closing, the major lesson for today is facial rejuvenation should be treated as a layered process. Assess fluid, structure, movement, and skin before choosing the treatment. Sequence care to avoid the overcorrection and use protocols to elevate both clinical outcomes and business value. The most successful practices are not just doing more treatments, they're creating clearer plans and better patient journeys. I have some wonderful news in closing on two things. Our next free masterclass is going to be on advanced hair restoration and regeneration protocols. It will be July 22nd of this year at 7 p.m. And we are going to have an in-person intensive training, date to be determined, in August. We're so excited about this. I can't tell you how many times I either bump into nurses, either in the clinic that are patients, nurse practitioners, PAs, even some MDs and DOs, and they're like, "I want to learn from you. I want to learn from Anthony." So now is the time. I hope you have all learned a lot tonight. And just for attendees of our masterclass, we are offering something very, very special. So I would like to interject. Anthony and I are really givers. We enjoy giving back and we enjoy teaching. So we want you, all of you, to join us in our clinic and learn our secrets, how to do things differently to make your patients happier and grow your business to be very, very successful. So we have a very, very special offer tonight only, and it is only going to be $199 for you to come and join us in our clinic and learn from us. If you want to enroll, type in the chat your name, or you could even call Rachel. Our number to reach Rachel at our clinic is 401-942-0600. Again, 401-942-0600. From all of us at RegenRX, from our heart to yours, enjoy the 4th of July, and God bless each and every one of you.
Yes, God bless. And we hope to see you on our next masterclass. And even more, we hope to see you in person at RegenRX, where you can learn our secrets and get some of our protocols that we use as well. And it's not overnight, ladies and gentlemen. This is a process. This takes time. This takes commitment. But I know that with our knowledge and that with your commitment, you can get this done. And we can build a better practice for both your patients and your business and yourselves.
We look forward to seeing you guys.
Take care. God bless.